Let us take a look onto the prostate gland. The prostate gland is glandular and fibromuscular organ, and it is all about like it looks like an inverted cone, just like how we have the bladder, but it's much more smaller. The weight is much more smaller, and also the size is much more smaller. You can see it weighs about 20 to 40 grams, and it accounts for about 30% of the secretion of the seminal fluid. Now, if you look at the measurement, it looks almost similar to that of the larynx. It is 4 centimeter transversely, 3 centimeter in height, and 2 centimeter in thickness. So, the larynx also measures about the same. So you can see that it's very small. And let's get a better view of this organ. So that's it. Now, if you look at the organ, you can see that it has a base, it has an apex, and it is located really close to the proximal urethra. Then it is also made up of a lot of surfaces. So we have the anterior surface, the inferolateral surface, and the posterior surface. Now let us see if an organ has borders, of course it's going to be having a lot of relations, because why do we have surfaces and borders? So that we can match them with different organs. Now let us see the relations in accordance to the surfaces and the border. The anterior surface, or anteriorly, the prostate is in relation with so it's in relation with the pubic bone, the retropubic space, the puboprostatic ligaments. Now, I'm just going to give you a quick overview. This is the pubic bone, so we can say the pubic symphysis is in the anterior relation, and then we can see, it's not really close. It's not really easy to see the prostate gland, but the one right here, it's in between, is the prostate gland. And as you can see, those two little ligaments right here are known as the puboprostatic ligaments. And the retropubic space is nothing but, okay, so for example, this is the prostate, and this is the bone, and the space in between them, there's nothing in the space, is known as the retropubic space. Now let us see the same things that we spoke about earlier in the atlas. So as you can see, these are the pubic bones, 1 and 2. And if I'm just going to hide this, so okay, I'm just going to take these out. So yeah, so that you can actually be able to see the other organs that I'm talking about. So taking these out is going to be, okay, I'm just going to fade them. So, okay. All right, just gonna take them off. Okay, so there you can see without the bone, there is a levator ani. Of course, we have the urogenital fascia, or the urogenital diaphragm, that's also in the anterior relation. But there's most importantly, you can see that there is this ligament, the small ligament, and this ligament is known as the puboprostatic ligament that connects the prostate anteriorly to the pubic bone. Then superiorly, we can find the bladder. So as you can see that there is this region right here is the superior border of the prostate. So this is the prostate, and superiorly we can find the bladder. So that's the bladder. Then what else you can find laterally? Laterally, that means here, we can find the prostatic venous plexus. It's not really visible here, but you can see that there are a lot of veins here near the lateral side of the prostate that are also called as the Santorinese flexor. And then we have the levator ani. So these muscles right here, 1 and 2, the left, and I think it's this one. So these muscles right here are the lateral relations, namely the levator ani. And then inferiorly, you can see the urogenital membrane. Now, this entire structure right here, this structure is known as the urogenital membrane. In this image, you can see right here, like how closely there is an attachment of the bladder with the prostate. You can see that there is an intimate relation, almost like the urine is poured into the prostate first. And that being said, let us see the relation with the other organs. So then we have the levator ani, as I said before. This is the levator ani muscles. I think I just highlighted it here. And Yeah, that's the lavatory Annie, and that's the lateral side. And inferiorly, we have this euro genital diaphragm. Now, let us look at the other relation namely the posterior relation. So, posterior superiorly, we can find the seminal vesicle. So, these small structures that you can see here, which are posteriorly but superior to the rectum, are known as the seminal vesicles. And then we have the posterior relation, which consists of this entire big structure known as rectum. Now, let us look at the arterial supply. The arterial supply is mostly done by the branches of the abdominal aorta, which is the common iliac. And rising from the common iliac, we have the internal iliac artery that gives off of the inferior vesical branch or the inferior vesical artery. Along with the inferior vesical artery, we also have another artery known as the middle rectal artery, which provides for the prostate. So that is how the supply looks like. We have this inferior vesical artery. As you can see, the inferior vesical artery goes into the common internal iliac, which goes into the abdominal aorta. Now, the next thing we can notice is there is the rectal artery. This is the inferior rectal artery that is also coming off of the internal iliac. You can see this is the rectal, and this is the vesical artery. Now, I'm also going to show you the venous supply. The venous supply is mostly done by the pudendal veins. And the venous drainage is done by the pudendal venous system. So this is the pudendal, and coming off of them, we have a plexus of veins that drain the prostate gland. Okay, so let us look at the zonal anatomy of the prostate. So the first zone that we can see here is known as the peripheral zone or the PZ, the peripheral zone. The peripheral zone encompasses most of the prostate, and this is where you can find most of the prostatic tumors. The peripheral zone is quite deficient on the anterior region, and hence on the anterior region we can find the anterior fibromuscular stroma of the prostate. Then you can also observe the fact that most of the prostatic urethra lies in the peripheral zone. Now, let us look at the other zone known as the central zone. So the central zone is another zone that is quite different from the peripheral zone. It's much more smaller, as you can see, it's much more smaller. The peripheral zone encompasses about 70% of the entire prostate, but the central zone only makes up about 25% of the prostatic region. It is wedge shaped, as you can see, it is wedge shaped and consists of the ejaculatory ducts. Next, we can see we have the transition zone. The transition zone is one of the smallest zone, making only up to 5% of the prostate. And what we can see is that this is the zone which get hypertrophied. So hypertrophied is that it increases in size as an individual proceed near senescent or as the individual gets older. So once that happens, there are also the formation of lobes that we can see. So this region gets divided into the two lateral lobes and a medial lobe and a posterior lobe. So yeah, that's about the zonal anatomy of the prostate. Let's take a look onto the microstructure of the prostate. The prostate consists of a lot of follicles, and all of these follicles are papillar. That means they have papillas in them. And then they're also provided by an epithelium, which is mostly of stratified columnar epithelia, or it can also be single columnar epithelia. Then the outer surface of the follicle is surrounded by a follicular capsule, and this outer surface and the space in between them, they're separated by the means of loose connective tissues. Then we also have a vascular supply between this loose connective tissue in order to give the nutrients to the follicles. Then let us take a look on a small follicle. So if you take a look at these follicles, you can find that they drain into something known as elongated follicular canals. And these canals, they come together and drain into main ducts. So there are 15 to 20 main prostatic ducts, and these ducts too, they converge in order to form a common duct. If you look at the internal microstructure of a typical prostatic duct, you can find that there is it is composed of a luminal area and a basal area. The outer basal area is cuboidal, consists of cuboidal cells, and the inner luminar area consists of inner columnar cells. There is also deposition of circular amyloid bodies, cuboidal or colloidal amyloid bodies that are also used for the secretion of prostatic fluid. Then all of these ducts, they come together and empty to the base of the prostatic urethra. The prostatic urethra, this is where you can find there is the emptying of the prostatic fluid. Now the prostatic fluid and the seminal fluid, they both empty into the base here. Now, what are the main characteristics of a typical prostatic fluid? You can find that the prostatic fluid is slightly acidic, and we can also say that it's slightly acidic, and we can say that it contains acid phosphate, amylase, so acid phosphate, amylase. Then we also have prostate-specific antigen, fibrinolysin, and zinc. Prostate antigens, we have antigens, zinc, and lastly also fibrinolysin. So keep that in mind. Now, there are also numerous endocrine cells that consist of analase or chromogranin or serotonin that are also found in the glandular epithelium. Glandular epithelium is found in the outer peripheral zones and consists of glands. Now these glands they also drain into the prostatic urethra. So we have glands here. So most of these glands they also in the peripheral zone they drain into the basal part of the prostatic urethra.